Hello folks, and welcome to our next video, which is going to be focused on the movements of synovial joints. So we're going to be talking about the main types of synovial joint movements, but remember when we said that not all synovial joints move the same? Well, that has to do with their shape. And their shape and their structure are therefore going to help us understand their range of motion. So if we look at the terms here, non-axial, uniaxial, biaxial, multi-axial, okay, then that means you're kind of focused on one word there, which is going to be an axis. Now, axis is almost like an imaginary line the bone can move around. And the number of axes is going to determine the range of motion a joint allows. So if it's non-axial, that means there are no axes, so it's not going to be a lot of movement. It's only going to allow for some gliding. Uniaxial means that there's one axis that the actual bone can move around, or one plane. Biaxial means that there's two planes. Multi-axial means that there's three planes. So you'll all be saying, what are you talking about, bro? Okay, so let's go ahead and write our good old graph that we're normally seeing. We see our x-axis and our y-axis. We also can have a z-axis, especially since we're talking about 3D. So when you're saying that something that only has one plane and is uniaxial, just say that it could be just specifically on the x-axis, for example. If we're saying something is biaxial, let's say that it can be on the x-axis and the y-axis, for example. If we're saying something is multi-axial, then that means it can be on all three planes. So it can be on the Y, it can be on the X, and it can all be on the Z. And so that's going to allow for certain amounts of movement, which gives more range of motion, which again is why some synovial joints are going to have less movement than others. Let's go ahead and first talk about the general movements. And these are going to be the movements that definitely you have to know, but then we're going to get into specialized movements, which you also have to know as well. So the general movements are going to be gliding, which is just flat bones that are kind of sliding past or slipping or sliding past one another. Then we're going to talk about angular movements, which means that you're going to have a change in angle between bones. We'll get to flexion, extension, and hypertension, abduction, adduction, and circumduction. And then we'll talk about rotation, which bones turns around its axis. So it's either going to be medial or lateral. Now, medial can also be called internal. Lateral can also be called external. So sometimes you'll see those be interchangeable. Let's go ahead and get into our first general movement, which is going to be gliding. Gliding occurs when the flat surfaces of two bones slide across each other. So you can think of it as two coasters sliding past one another. It's going to be a very small motion, okay? And there's not going to be a particular axis. So they're just sliding across one another. That's it. Or you can just say they glide or slip over one another. Now, yes, it's going to have a very small effect. So yes, they can kind of glide up and down. They can glide left and right as well. Let's keep that in mind. And it's going to be really small movements. But if you're talking about all of the bones that we see, the bones here in our wrist, or if you're talking about all the bones in the wrist, they could have a cumulative effect. So you might be like, I can move my wrist around. I don't know what you're talking about. It's not just gliding. No, they're all gliding together. But again, a cumulative effect means that, yes, two bones are sliding past one another, but then the other bones are also sliding and moving as well. So overall, they can have that cumulative effect where it seems like there's more movement going on. Okay? All right, folks, let's go ahead and get into angular movements. And we talked about flexion, extension, and hyperextension, and also abduction, adduction, and circumduction. Those are going to be our angular movements. Now, with angular movements, the first thing you want to kind of focus on is dealing with, especially with flexion, extension, and hyperextension, we need to focus on the sagittal view, okay? So here's a sagittal plane. And again, I kind of wrote little dots here. And as you can see, we have a sagittal view or a side view for all of the actual images that we see here as well. Now, flexion is equal to bending, okay? And that means you're bending along that sagittal plane. So your head can bend, it can bend forward. Your body trunk can bend forward, for example, and your knee can bend backwards, as we can see. And the whole goal of this is to decrease the angle between two bones. You also can have your arms flex at the actual shoulder, as we see here, and that can also be considered flexion. So what do we mean by decreasing the angle? Well, again, if your angle is going to be larger when you have it kind of straight down in sagittal view, and then I bend my leg up, that's going to cause the angle to get smaller. That's what that means. So you can see that we have flexion, bending the knee up, flexion, lifting the actual arm flex on the shoulder, and then you also can have your head bend forward as well, okay? Extension is basically the reverse of flexion. So extension is going to straighten a flexed limb. So I think of extension. Now, it doesn't have to straighten it 100%. Like, for example, we see here, we have our bended knee that we had here, which is going to be flexion. And then we kind of just put our pointed toe to the bottom, which again is going to increase that angle. And if you were to just go straight, you would just have complete extension here, which means that you're going to go into a straightened position. Okay. Let's go ahead and look at that same shoulder. We have flexion, which is going to be, again, an arm flex at the shoulder. And then extension will be just putting your arm to the side. Also for your body trunk, which you'll see as well, if I was to bend forward using flexion, if I go back in upright position, I'm back to extension. And then finally, we have hyperextension. And hyperextension just means beyond the anatomical position. Beyond the anatomical position. So for example, if we have flexion with this arm flex at the shoulder, then we have extension going back to a straightened position. If we were to go backwards and put our arm behind us, then that means we're dealing with hyperextension. Okay, let's get into a couple more examples. Again, with the head, extension is going to be upright, hyperextension is moving your head back, and flexion is moving your head forward. Same with the body trunk. Extension is going to be an upright anatomical position. Hyperextension is moving your body trunk backwards. Again, outside of anatomical position. Flexion is moving your body trunk and bending it forward. So that's what we have there as well. Get into our last group of angular movements, which are going to be abduction, adduction, and circumduction. So for these kind of movements, we want to know that we're focused on the frontal plane. So you can see here we have the frontal plane that's going to be a focus for these movements. Now let's talk about abduction. Abduction, okay, that means you're going to be moving a limb away. Move a limb away. Away from what? From the midline. Okay, then we're going to have adduction, which is going to be move a limb toward the midline. Okay? And again, the best way to remember these is by doing the actual movements themselves. And finally, we have circumduction. And this is going to create a cone. So first, just draw a cone. Okay? You have the point of the cone, and then we have the larger base of the cone itself. Now, to create this cone, as far as movement goes, you focus on a particular joint. It could be the shoulder joint or usually the hip joint. That's going to kind of stay stationary like we have a point here. So here we have a point at the actual shoulder joint. And again, we're going to be able to create a cone. Now, the base of that cone is going to be the distal end, like we have our hand here, and its ability to move in a circle. So again, you can put your arm out and move your hand in a circle. That is circumduction. Why? Because we have a point, which is going to be our shoulder joint, and of course our hand is going to be the end that allows it to be in a circle. Another thing you can do is just put your leg out as well. And the point is going to be your hip. The point of the cone is your hip, and you can move your foot in a circle as well. That is circumduction. So abduction, again, is going to move a limb away from the midline. So say you had your anatomical position, you're going to move your limb away from the actual midline here. Okay? And because you're moving your limb away from the midline, some folks will say abduction, I'm moving away from the abs or the ab region. Okay? Adduction, you're going to be moving your limb toward the midline, so it's literally the reverse of abduction. So I can just have my body in anatomical position. I'm moving further away from the midline. There you go. Abduction. Moving further away from my abs. I'm moving closer to the midline. There you go. Adduction. And here's the cool thing about this. You also can focus on the hand itself. If you were to spread your fingers out, that would also be abduction because, again, you're spreading it further away from the midline. If your fingers were to come back together like you see here, that also can be considered adduction because, again, you're closing your fingers, and that's going to make them closer to the midline. We're done with angular movements. Let's focus on rotation. And we said we had two types of rotation, which is going to be medial rotation, or you can also call it internal rotation, or lateral rotation, which you can also call external rotation. So when I see lateral here, I can say external. When I see medial here, I can say internal. Now, rotation just means that you're turning a bone around on its own axis. What is this common with? Our good old cervical vertebrae, C1 and C2, the atlas and the axis, right? Those cervical vertebrae allows you to move your head and twist it from left to right, left and right. That's going to be a portion of rotation, okay? And also remember, we're always focused on toward the midline or away from the midline. So we do see that we have our midline here. And if you're going away from it or towards it, that's going to be what we have. But you also can have that general rotation or just left and right like you see here. Okay? Now, the best example is going to be your legs. So one thing, you can have your legs straight in anatomical position. If I was to put my foot out, okay, meaning going away from the midline, what is that going to do? It's going to cause my femur here. So don't forget, we have our little femur here. We have our femur here. And if I'm moving my overall foot out, now my femur, the anterior surface of my femur, moves away from the midline. So I'm moving it out, the anterior surface moves away from the midline. If I have medial rotation, then of course the opposite is going to occur. Medial rotation, my femur is going to move toward the midline, okay, or the median plane. Okay? You can also just say, okay, the anterior surface of the femur is going to move toward the midline, or the anterior surface is going to move away from the midline. If you're talking about this example when it comes to the femur. Now remember, internal rotation means medial rotation. You're going towards that midline, so you're going internally towards the midline. External rotation is also called lateral rotation, so you're thinking of side, so you're going away from the midline. Okay, you're going to the side. You can also think of that way as well. All right, folks, so we have our general movements. We have, again, our gliding movements, our angular movements, and rotation. Now let's get into the specialized movements. And specialized movements are going to be supination and pronation, opposition, dorsiflexion and plantar flexion, inversion and eversion, elevation and depression, protraction and retraction. And we're going to get into each of these next. One thing to note about the special movements is that they're movements that are specific to different body parts, of course, different bones and their joints. Okay, folks, so keep that in mind. Let's first focus on pronation and supination. This is all about the radius and the ulna of the forearm. This is all about whether or not you can have your palms up or your palms down. So supination means to turn backward. Turn backward, that's one little general thing you can say. Whereas pronation means to turn forward. Now we got to focus on what does it mean to turn. So when we're in the anatomical position, our palms are up, correct? And that means, if you can see here, our palms are up and our ulna and our radius are parallel to one another. So you can rotate your forearm laterally to have your palm face anteriorly or to face up, okay? So that means if I make sure I just go from my palm is down, now my palm is up, I'm going to rotate my forearm laterally, which is going to cause the ulna and radius to be parallel to one another, okay? Now, if I'm talking about pronation, which I'm going to be turning forward, then my palm is going to be down, as we can see here. My palm is down. What's going to happen to the radius and the ulna? The ulna and the radius are now crossed, okay? They form kind of like an X. So that means your forearm is rotating medially and your palm is faced posteriorly. You can also add those terms in as well to make it easier for you. So that's what we mean by turning forward. We're meaning that our palm is down. Turning backward means that our palm is up. Okay, so this is going to be pronation here. This is going to be supination. And one way you can do it is when you're on an exam is just to turn your palm up, okay? And you're going to see that you're dealing with supination, palm down, you're dealing with pronation. Let's go ahead and move into opposition. Opposition is all about the thumb to fingertips. It's all about grasping with your thumb to fingertips. And you can also just say that it means your thumb is going to touch the tip of the other fingers on that same hand. So this thumb is going to touch your index finger, your middle finger, of course your ring finger, and your pinky finger as well. Why is opposition important? Again, it's good. It helps your body be able to grasp things with your hands and manipulate objects. So again, being able to touch the tips of your thumbs to your pinky and all the rest of your fingers on that hand is opposition. If you're asked about opposition, just simply find a way to connect your actual joints that you see with your own eyes to the material. So I can just literally put my thumb to my fingertips here, and there you go. That's opposition. Next, we have dorsiflexion and plantar flexion. That just means up and down foot movements. Okay? So dorsiflexion, you're going to lift the foot. And of course, plantar flexion, you're going to plant the foot, but you can also say you're going to point the toe. Okay? That's one thing to make it easier as well. Now, dorsiflexion is going to lift the foot so superiorly that the surface of it is going to approach the shin. So we have our shin up here, we have our tibia, and as you're moving it forward, you're almost like, hey, I'm trying to lift my foot up enough so I can actually touch my shin. Is that going to happen? No. But that's the idea of it, is just lifting up to see that it's kind of trying to point at the shin. When I lift my foot up here, I'm doing the same thing. I can see that it's pointing towards that shin. Whereas when I have plantar flexion, I'm planting my foot down, and it's going to be at the actual toe. Okay, so it's almost like you're pointing your toes down. And that's dorsiflexion and plantar flexion. Again, because the special movements are specific to certain bones and certain areas of the body, it's easier to be able to understand as well. So make sure you are keeping these examples so that you can connect it to the material. Let's go ahead and talk about inversion and eversion, all about the soles of the foot. Okay, is the sole of the foot going to be facing medially or lateral? So inversion means that the sole of the foot turns medially. Sole of the foot is going to be turning medially. Eversion means the sole of the foot is going to be facing lateral. Let's see a perfect example here. Put your foot in anatomical position. Then you want to turn the sole of your foot medially towards the midline of the body. That's going to be inversion. You turn it laterally towards the outside of the body. That's going to be eversion. And this is like the worst, because this is where a lot of sprains can happen. And every time I see inversion, I'm thinking I'm spraining my actual ankle in some kind of way, and that's going to cause pain. So just little details like that as well. Okay. Now let's get into elevation and depression. Elevation and depression is all about lifting your lower jaw or your shoulders, and then of course moving them back down. So elevation, as we can see here, moving the mandible up. Okay, so that means you're going to lift your jaw up. You can also say lift the body superiorly. Okay, depression means that you're going to be move the body part inferiorly or move down. Okay, so I just write like move down here. Move down. So you can see the jaw is going to be, the mandible is going to be lowered and your mouth is open. Okay, another thing you could say is elevation is shrugging my shoulders. Well, I don't know, right? And then as you shrug your shoulders, depression is putting them back into the same position they were in. Okay. Another thing that you can notice about the jaw as well is that think about when you're chewing. When you're chewing, your mandible is going from elevated to depressed, to depressed, so that you can actually chew your food for better digestion. Okay, folks? Let's move on to the last special body movement, which is going to be protraction and retraction. This is all about the mandible being pulled out, the mandible being pulled back in. So protraction is going to be moving a body part forward. You can also say moving the body part anterior. And of course, retraction is going to be pulling the body part back. The example that we mainly see is going to be that mandible. So if you were to jut out your mandible, or you would just basically try to have your teeth, your bottom row of teeth, touch the top of your upper lip. Now my mandible is doing protraction and moving forward. And then of course, when I go back to normal or retract my mandible back to how it was, let you know I'm dealing with retraction. So that's a lot of information to get through. There are a lot of tables that can help you, like be a little quick guide for you in your textbook, like table 8.2, which gives all the movements of synovial joints. And also table 8.3 can be used as a tool as well. My recommendation is to pick one example to help you through. So for example, when you're talking about the special movements, because they're specific to certain body parts, that makes it a little bit easier to remember. But when you're talking about the general movements, like angular movements, flexion, and extension, hyperextension, make sure you're focused on either the head moving forward, the head moving all the way back in hyperextension, or being in anatomical position for extension, for example. Okay, just make sure you have something you can go off of. I'll see you in the next video where we're going to be talking all about the types of synovial joints and bring it all together. The types of joints, the types of movements they can make, and also the axes they potentially could be making these movements on. All right, folks, see you in the next video.